Hello there and welcome back. So today I'm going to try and keep today's video on the 5 minutes. So let's see if we can do that. If you're seeing this and this video takes longer than 5 minutes, then we'll try again next time. So I just want to quickly talk about my past couple of weeks in my posting hematology oncology, which has been a good experience. To be honest, when I started off, it's just like pediatrics, hematology, oncology, and pediatry. The way I started off, because I started off with a lot of patients, and so I needed that period of adjustment to the workload. But it wasn't unexpected because um, from Pete's Onco and radiotherapy postings, I was already prepped. Like, these are the kind of things I'm gonna see, so I was good to go. But so far, no issues. Decent number of consults, decent number of patients. Thankfully, we have um, two other interns working with us. So I'm not the only house officer in the unit. I was for a brief while. I was for about 2 weeks. That was when the work was, a whole lot on me. But I managed it well, I believe. But then it's so much easier having two other people to help out with the patient management and carrying out the plans that the team decides that we want to do. So, good so far. I have an amazing consultant. I have a consultant that says thank you 10,000 times a day. How gratitude, how she expresses gratitude is something that I have really learned from. Cause from doing sometimes even doing your job, um, would attract so many thank yous. Oh, Emmanuel, you did great with this. Oh, this was spectacular. My head is going. I'm thinking, oh, house officer of the year. You know, but it's nice how she encourages you with those very very kind words. Very interesting person to work with, very caring person to work with. So at some point we had these NSARS protests ongoing, and because of that there was a curfew and the many shops didn't open. um, Many places were locked. So she called, the consultant called me. If you're watching this video from uh, probably another country, like I believe someone from Rwanda saw a video the other day. I don't know how things are over there with your consultants. I'm sure they are very nice. Here we have a good working relationship, mostly with the consultants, but it's not very common for you to see the ones that go the extra mile to call you on your phone, and they're not calling you on your phone to ask about the patients. They're calling you to ask about, oh, do you understand there's a curfew going on? Do you have enough food to last through the weekend? Do you need any money? Do you need any assistance? Do you need help in any way? Is any This call was for, like, my consultant called me and we spoke for minutes, and not a single patient name was mentioned. When the call was done, I literally needed minutes to analyze what just happened because it was so unexpected. She's the sweetest. And then any week that is more intense than usual, actually now it's just about every other week. She does this happy hour where she buys lunch for everyone in the unit. So right now we have a registrar, a senior registrar, and some house officers in the unit. So she gets lunch for everybody. She's amazing. It's amazing, and it's good to have consultants like that around, so that when some other ones um, are a bit more challenging to work with, you still remember that there are really, really, really good ones out there, and you don't get discouraged in that at all. So moving on from that, this past week we had our hematology unit presentation on CML, that's chronic myelogenous leukemia, and guess who was taking the case presentation as part of the team? Me. So this would make it two ground rounds. I did when I was in pediatrics hematology oncology. I also did the unit presentation there, and over here again, I'm also doing, uh, you know, taking the unit presentation. So it's been nice. It's nice to present to all these, big professors. It's a ground round, so everybody's the professors are there, the consultants are there, and once you start talking, everybody keeps quiet and is waiting for you. So while I was performing, it's amazing how the walk up to it, I was preparing so much, gearing up, getting my slides right. I reviewed with my consultant many times. Like I think we adjusted those slides like 3 times or so. We really, 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 really putting a lot of work into getting done. So getting ready was the moment of I'm going to present to this week. But in that moment where I had to actually start presenting, I was cool as ice. There was no, I was actually did pretty well, if I say so myself, in terms of like I'm pleased that I wasn't fidgeting, that I wasn't panicky. It was cool, it was controlled. By the time I was done, the professors lauded, they applauded my efforts. And by applauded, I mean they gave kind words to my presentation. Some people thought I was a registrar. So all in all, good. Of course, you had them. When we finished talking, and then they were like, "Any questions?" Medical students, nobody said anything. House officers, nobody. Registrars, nobody. Senior registrars had no questions. So when it came for consultants, I held my breath, and then of course, consultants raising. Like, oh, I'll be raising my hand, and I just held my breath, waiting for, okay, what do they want to say? And then the professor started off with a, "Thank you, Dr. Kaho, for that very clear, lucid presentation. It was quite impressive." It's like, okay, this is nice. And then she asked a question, which I responded well to. Another professor came and made a comment taken, and other person asked another question to wrap it up. And once my part of that presentation was done, I was happy, relieved, and thankful that I had completed that part of the presentation. So that was one thing about that week. Look at my 5 minutes is out the window because we're doing 7 minutes right now. But I'm just going to mention a couple of cases I found interesting. There was this 25-year-old guy who had recurrent priapisms. So he hadn't been too regular in clinic attendances. So he had just been showing up to different hospitals, emergency rooms with priapism. So thankfully he came to us to see us. We saw him in the ER. Of course, we did our hydroxyurea and the whole works. Urology team came and reviewed for the priapism, did a shunt for him. But the interesting thing about this is that the resolution of the priapism wasn't straightforward as you'd think. So after the first shunt done by urology, it resolved, but then came back up. And then they had to do another shunt. It came back up. So we had to do an EBT. Did an EBT for him before that result. He needed 3 shunts and an EBT, which changed like 4 pints of blood for that young man to get back on. But thankfully, he's discharged. The very amazing thing about managing patients is when you get to actually see them recover and see them do much better, especially when you saw them when they came in. When a young boy came in, he was having pain because the priapism, the erection was painful. So he was having pain, he was in distress, young guy with, the whole... Okay, for those that don't know what priapism is, I apologize. Priapism is a purposeless, persistent, usually painful penile erection. So that is unprovoked many times. So in that case, it was unprovoked. He wasn't, he wasn't aroused in any way. However, he just noticed that persistent erection. So I was so thankful and happy for him that we got that sorted. We're scheduled to see him clinic next week. So he's doing much better. So that's the joy when you see them when they are leaving, they are all smiles compared to how they came in. Reminding me of, I believe I mentioned this lady in an earlier video, this lady that came in bad about a month ago with symptoms of acute chest syndrome, but she had this bad bronchopneumonia that took weeks. She even went to the ICU at some point. But I saw her in clinic last 2 weeks. I've seen her in clinic twice now. I saw her in clinic last 2 weeks, and she was absolutely, you wouldn't, I didn't recognize her at first because well, partly because she had a mask on, but then the radiance from this woman was totally different, because I saw her when she was so bad, when she was, lamenting about, oh, uh, this thing, this sickle cell disorder, how, if parents were more careful, we wouldn't have any more cases of sickle cell anemia. And she was pretty bad. This time my SpO2 was 86%. But to see this lady bubbling, she was already going. By the time I came in, the lady was, I didn't know it was her then, but she was already going like, she had this bubbliness about her. So my consultant was like, look at your patient. And then I saw it was her. I literally screamed. I was so happy to see her all bubbly, all good. She's come to clinic twice now. No, you would not know. And she's back to work, or she's scheduled to go back to work next week, and actively continue working. So I was super happy, and that's one of the good things about medicine. When you are able to help people get back to, it's not just keeping them alive, it's getting them back to that standard of life that they had before the illness began. And a lot of times we're grateful that we're actually able to do that. I'm going to try and remember if there's one more case I want to talk about before we go for this episode. Yes, there was a chemotherapy patient that we had, so we're managing him for CLL. And yes, I think the main thing I want to mention is the mini drama when he had an infusion reaction. So in the management and the protocol we have for this man in the CLL protocol, his chemotherapy regimen, so he had rituximab there. And while the rituximab infusion was ongoing, of course, thankfully we were prepared, in giving the chemotherapy. So we're aware that there may be an infusion reaction. So all of a sudden, this man, while getting the infusion reaction, started having this rigor and chills. And it was so profound. The bed was literally shaking. He was just going, with the chills and the rigor. And someone else that saw it came and panicked. And, oh my God, this is happening. So, but we being, the people that were doing our own thing, we got there and just took the necessary step to stop the infusion. Did what we had to do, gave it some time, and we recommenced it after a time period, and he took the rest of the rituximab well, doing well on chemotherapy, has been discharged. He's gonna see us in clinic pretty soon. So these are a couple of interesting cases, and all about the presentation that we had. So all in all, it's been a pretty interesting period, pretty interesting posting. I have about 40 days to go to the end of this posting, so I'll keep updating you all. Thank you so much for watching. Don't forget to like, don't forget to share, don't forget to subscribe. If you're looking at this video, please hit that subscribe button now. Just push it if you haven't already. And if you're seeing this on maybe Instagram, Twitter, my WhatsApp status, just reshare and leave me a comment. Let me know what you think about the videos so far. So thank you so much for watching. I'll see you another time.